Well, with growing concerns that Labor Day celebrations could send the country's COVID-19 rate soaring once again, we wanted to give you a much needed refresher on the coronavirus and where everything stands right now. It's always changing. Tonight, we're debunking the myths and getting down to the truth on how to keep yourself safe from this virus. Our Delia Goncalves joins us live now from Southeast. Hey, Dee.
Welcome back, Zoe. You know, we're 6 months into the pandemic now, and thankfully getting items at the grocery store like toilet paper and cleaning products pretty easy right now. But health experts say that some of us are going to extreme and sometimes unnecessary measures just to feel safe. There's even a name for it: sanitation theater.
This viral video from early August showing players from the Denver Broncos walking through a sanitation mist, well, that's an example of what some are calling sanitation theater.
You don't need to go to these extremes.
Emmanuel Goldman is a microbiology professor at Rutgers, New Jersey Medical School. He says COVID-19 is a fragile virus that doesn't last long outside the body. So do we need to wipe down surfaces with harsh chemicals?
Normal hygiene is sufficient. Soap and water kills the virus. Ordinary alcohol kills the virus.
However, the professor says high traffic areas should still be cleaned. Anthony Capozzoli is the COVID-19 czar for the Restaurants Associates based in New York.
High touch surface disinfecting is here to stay, but I think we do need to worry about the frequency of how often it is being done.
Where do you draw the line so your customers feel safe coming back indoors, but not doing an excessive amount that is beyond what's necessary?
Yeah, so you hit on it. It's the perceived safety versus the actual safety. And for the foreseeable future, the consumer sentiment is that they want to see the additional safety measures.
Should restaurants consider air circulation?
There's a lot of discussion on the additional HEPA filters and these small filters that circulate air. And I'm all for it. However, there isn't enough science at this point.
So Capozzoli says getting fresh air circulating is the goal right now, outdoors or indoors with windows open. He says those measures, coupled with health screenings, masks, and social distancing, are key to keep businesses open.
Should we do anything differently as we approach the cold and flu season?
Just wearing masks.
According to the CDC, coronavirus is transmitted from person to person through respiratory droplets when they cough or sneeze. So your best defense, continue wearing masks, social distancing, and washing hands.
So the professor goes on to say, you know, in the beginning of the pandemic, there was a lot of well-intentioned but misinformation out there. Like, remember hearing about washing and even wiping down all of your groceries before you head back into the house? Well, he says that created some unnecessary habits. And the way to break that, because things are changing, like you said, Zoe, he said, get educated. Lean on your trusted sources for ways to keep yourself safe and healthy during the pandemic. Zoe, back to you.
Good reminder there. Dee actually had a couple of friends who were wiping down their groceries every time they got in from the grocery store. And they stopped suddenly after about a month or two after they realized, you know, hey, maybe this isn't worth it.